Lung cancer is the leading cause of cancer-related deaths worldwide, primarily because too often it goes undiagnosed until it reaches an advanced stage. Early detection is the key to successful treatment and survival.
It's because if you catch cancer early, you can treat it more effectively. People live longer, they live healthier lives. You can cure lung cancer, but you have to find it at an early stage. And that's where CyPath Lung comes in.
CyPath Lung is a new patient-friendly, non-invasive test that uses flow cytometry and artificial intelligence to analyze the entire lung environment to accurately identify cancer or cancer-related cells in patients at high risk for lung cancer.
The dilemma is, let's say that I go in to see my doctor for a cough, they do a chest x-ray, and there's a small nodule in my lung. You can make guesses based on smoking history, family history, cancer, those sort of things. But basically you can do one of several things. You can either do serial low-dose CT scans, which doesn't sound like it's bad, but you have to do them frequently, like every 3 to 6 months, to see if this thing is growing or not. It's a lot of radiation either way. The other alternative is, if it's big enough, stick a needle in it under conscious sedation for the patient, get a piece of the tissue and send it to pathology.
CyPath Lung offers doctors and patients another interim option.
Low-dose CT is really good in catching cancers. So that means that the sensitivity of the test is really high. But it does so by also identifying other nodules that are not cancer-related, also as a positive. So if you have a positive low-dose CT test, you have a very low chance, actually, that it is a cancerous nodule. That's the beauty of CyPath Lung. And CyPath Lung, our test, shows that, especially in those small nodules where there's a problem, we have a 92% sensitivity, which means that we catch 92% of them, only miss 8%. But that we're also pretty good in that if we have identified them, there's also a high specificity, meaning that there's a much smaller number of patients, like the low-dose CT has, that do not have cancer. So, and the specificity in that cohort of patients is 88%. So nearly 90% for both sensitivity and specificity is a really good test.
Using the CyPath Lung test is an easy process for both patient and doctor. The physician orders the laboratory-developed test from Precision Pathology Services, a CAP/CLIA certified clinical laboratory. Patients receive a kit that includes instructions for collecting sputum samples over 3 days and one-on-one support from a patient coach. After collecting the sample, the patients send the sample back to the lab in a prepaid overnight clinical pack. CyPath Lung patient Steve T. talked about his experience with the test.
It was a process, a product that came to the house. You could do it in the comfort of your home. It didn't require a huge commitment. It was a 2 to 5 minute process each morning, 3 mornings in a row. I didn't find it to be complicated. I found using the acapella device that it produced the appropriate, samples without worrying too hard about it. And then once I was done returning it, I thought it was an easy process. Having a coach, I thought, was really helpful because she kept me honest. So once I started it, I was committed. But it was non-invasive. It didn't require a visit to the hospital, and it was something that you felt that you were being proactive on. So I thought it was a simple, elegant diagnostic tool.
The technology behind CyPath Lung started with a porphyrin compound that labels cancer or cancer-associated cells. Our scientists took that simple concept and developed a high-throughput, unbiased, and accurate test to provide both clinicians and their patients with actionable information that can save lives.
The machine learning, the AI, the ability for us to use automated analysis is a game changer. There's no doubt about that. It standardizes the outcome. It makes it easier for our lab techs to do their work and for our physicians to get their report in record time, and really literally in minutes after data is found, we have a physician's report.
It's a test that because of its simplicity for both patients, because it's a non-invasive test, as well as for doctors, I think can make really a difference. And because it's so simple, you can use it over and over and over again. It has no side effect.
This is undoubtedly the single most important thing I've done in my whole 50-year career in medicine. It will save lives. It will change lives.